Hello guys, I am Dr. Rahul and I will be discussing today about the most recent questions asked on psychiatry for your upcoming exams. Hope this session will be helpful and I will suggest you to watch these videos at 2x mode, right? And approx I think 7 or 8 questions is asked in your different exams from this subject. So a short session is enough, I guess. If you have the concepts right, you will go to the this short session. That's enough for your upcoming exams, which is knocking in the door only. Just few weeks left for all the exams, right? Okay. So we'll start. Okay. So I will start with a presentation of few diseases at present. Presentation of few diseases like first I will take something like panic attack, right? So in panic attack, what happens, the person feels something we say as impending doom, right? Impending doom, as if he is going to die or something bad is going to happen to him. His heart rate will increase, right? uh, he will have a feeling always that something bad is going to happen to him, like he is on a journey and he may feel that he may get to a RTA or like that. He will always have a impending doom pattern that something bad will happen to me, or like I will have a heart attack or something like that. There will be always increased heart rate, right? These are the features of panic attack, correct? Okay. Now next we will go to another condition, GAD, generalized anxiety disorder. Here the a patient will be always in a worry mode, right? He will always be in a worry mode with or without any reason. Means if there is no reason to be worried of, still he will be in a worried mood. Better we can say, as a better term is uh, free floating anxiety. As I say, it is a better term. You can find this word in exams in your case scenarios as well. There is a free floating anxiety, right? This word has been I've seen this word almost in repeated in 2-3 questions, right? Free floating anxiety, always in a worry mode, right? So this is a generalized anxiety disorder. Okay, let's go to next. There is phobia. Phobia is a condition, there is irrational fear. Irrational. Now there may be different type of phobias towards a thought, towards an insect, towards a circumstance, right? Okay. So this is irrational fear towards something, right? Towards any thought, towards any insect, towards any condition, towards you can say, like someone fears night, someone fears dog, right? So there are different types of fear, so all that falls under the category of phobia, right? Okay. Next there is anhedonia. Now anhedonia is a condition where, first of all, it is seen in depression, right? Now this is a condition where the person is not interested at the activities in which he was previously interested at. Like previously he used to enjoy movies with his friends or enjoy with his family, enjoy spending time with his family, but now he is like not interested in this type of these things. He remains aloof, or he likes to stay alone, or things like that. So this falls under anhedonia, correct? Okay. Now this is an important question which has been repeated, like hypomania. These two conditions, right? Hypomania and mania. This has been repeated in many exams, right? So To diagnose hypomania, it will take almost like 4 days. Okay? And for mania, it will take almost 1 week. So first thing is hypomania 4 days, mania 1 week. Correct? I will be telling the most salient and most precise important points for your exam. Right? Okay. So in mania, there will be psychotic symptoms is present. Right? In mania, psychotic symptoms will be present. In hypomania, no psychotic symptoms. Correct? Okay? And this is enough. And another thing is you must remember hypomania, right? You must remember something is known as bipolar disorder is there is 1, 2 and 3. These are the subtypes of bipolar disease, right? 1, 2 and 3. The important thing is about 2. Remember the 2. 1 and 3, okay, if you don't remember it will be fine, but remember the 2 because 2 has been repeated twice or thrice, right? So bipolar type 2, this pattern is 2, right? So you remember as H. We like this, no? H. Bipolar 2 is hypomania plus depression, right? Hypomania plus depression is bipolar 2. So remember this point, right? This has been repeated. Bipolar type 2 is hypomania plus depression, correct? Okay. So now next we will go at a condition as BPD, or we say EUPD. BPD is bipolar disorder, correct? Bipolar disorder or emotional instability personality disorder, as we can say, but this is the term which is used, most often. So here there is relationship troubles, right? There is relationship troubles where the person attempts suicides, or this is attempt of suicide, right? With no intention to kill himself, just to harm. Attempt suicide to harm, just harm himself, right? This is an attempt to harm, and there is relationship troubles. With these two, you can diagnose BPD or EUPD, correct? And the management is CBT, right? Cognition behavior therapy. Now again, this has been asked that management is CBT, and CBT is discovered by someone called Marsha Linehan. Marsha Linehan. He discovered CBT. This is important again, right? Now going into next there is a syndrome called as Rett syndrome. Rett syndrome, correct? Now Rett syndrome seen in females and by 6 to 3 years, correct? 6 to 3 years the female is normal, and after that which is the Rett syndrome. Now the important question asked in Rett syndrome is the gene associated, right, which is the MACP2 gene. Up to 3 years everything is normal. After 3 years the female develops this syndrome. Now, what happens in this syndrome is like there is midline stereotypic behaviors, right? Midline stereotypic behaviors, by which I mean that uh, the child will do some abnormal behaviors, in the midline of his body, like repetitive behaviors or dropping things. Okay, poor eye contact, less playful compared to the fellow children, right? So this all falls under this category, Rett syndrome, correct? Now I prepared a list for you guys, like whichever things has come in recently. So I'll be taking this session completely based on my list which I prepared overnight. Okay. So next another syndrome is there, like Heller syndrome. This typically occurs in boys. Okay, Heller syndrome occurs in boys. This is a bladder issue, purely bladder issue. Up to 2 years everything is normal. After 2 years the child is having bladder issues, right? Bowel and bladder issues. The pen is not working, right? Okay, bladder issues, right? Chalo. Next I will talk about some important topics, like there are I will make it this one, anorexia nervosa, right? This is also an important topic, anorexia nervosa. Then there is uh, binge eating. Okay, binge eating. Okay, anorexia nervosa, binge eating, and binge nervosa, right? Anorexia nervosa, bulimia nervosa, and binge eating, correct? Now see, anorexia nervosa. This is the highest mortality out of all. This is the highest mortality out of all the three. Anorexia nervosa is the highest mortality, correct? It is mostly seen in females because of their constant worry about their weight. They feel that even if they are slim and they are not eating, they will feel that they are gaining much weight, and for this they will stop eating, right? For so there are two criterias, like this may be two types, right? One is restrictive and there is binge purge type. These are two types. So this is not important. What is important is that the criteria of the BMI here. So BMI is less than 18.5, okay, as per ICD, and less than 17.5 as per DSM, okay. These are the BMI criteria of anorexia nervosa. So there is restriction. Do remember, there is restriction. Also there is binge and purge. Both types are found in anorexia nervosa, mostly common in the females, correct? This is over. Now bulimia nervosa. See, bulimia nervosa BMI is normal, okay. In bulimia nervosa BMI is normal. There is compensatory behavior is there, but still BMI is normal, right? What is compensatory behavior? I will discuss it in the binge eating, this one. Now in binge eating, it's also seen in mostly females only, but in binge eating BMI is increased, right? BMI is increased. Now what I was talking about, the compensatory behavior, right? In binge eating, there is only binge means guilty. If a sensation of guilty, only guiltiness is there and nothing else is there. No behavior, nothing is there. No vomiting, no purging, nothing like that. Like, you will eat the entire day and at the end of the day you will feel guilty that I ate so much. That's only. So that's why BMI is increasing here, correct? And here is, you see, BMI is normal. In bulimia nervosa BMI is normal because here you will be guilty, and after the guilt he will vomit or purge out all the contents he ate, right? Before he was guilty, correct? Whatever contents he ate, he will just throw it out. So there we will see Russell's sign also. Russell's sign is, while he is purging the or attempted vomiting, there will be marks in his knuckles because of the attempt from his teeth, because of the attempts he made while vomiting. This is the Russell's sign. This will be there. So compensatory behavior is present in bulimia nervosa, and here because he is vomiting out all the contents, so BMI will be normal. So you understood, right? So here BMI is less than 18.5 or less than 17.5. Here BMI is normal and here BMI is increased, right? This is very important topic, so please keep in mind. Now coming on to few terms. Okay, so before that, there is an important thing like neurosis versus psychosis. Psychosis is the most extreme form, okay. Neurosis is okay, but psychosis is the most extreme form in an disease manifestation, in mental disease manifestation, right? So I remember it's something like that. Jipmer, right? I need four letters, just Jipper. So judgment, insight, personality, and reality, correct? These all are intact in neurosis. These all are intact because this is less aggressive form, correct? Neurosis is less aggressive form, but psychosis is all are gone because this is the most extreme form of psychiatric disease manifestation. Psychosis is the most extreme form. So this all, judgment, insight, personality, everything is gone in psychosis. Everything is lost, correct? So I hope this is clear. Okay, now there are a few terms which I want to highlight. First is alexithymia. Just try to follow my explanations. Alexithymia. So alexithymia is inability to express the emotions, right? This is found in males usually, right? So alexithymia is inability to express one's own emotions, right? I repeat, inability to express one's own emotions, correct? And then there is aesthesia abasia, correct? Now aesthesia abasia is a bizarre gait, right? There is gait disturbance. This is seen mainly in conversion disease, also known as dissociative disease. Okay, this I will explain in my later this one slides, right? So okay, now before that I also discussed mania, correct? So in mania there is something, so I will take another page. This is important, right? So you must note it down. So in mania there is something known as clang association, correct? Guys, I cannot explain everything here, so I hope you have done the main videos. So this is a revision type session, so I hope you can cope up with this, and if anyone has any doubt, they will put in the comment box. I will take up these queries in the next video, right? So mania there is clang association, right? Then there is flight of ideas, means there is too many ideas coming at one point of time. Means so many ideas coming, right? Then there is speech pressurized speech. So if you find these three words, you can say in your question, so this is going towards mania. So in mania there is clang association, flight of ideas, pressurized speech. Okay. Next we are going to hypomania. This is also important. I think this is come in uh, recent NEET PG also. Prolixity of speech, right? Prolixity of speech is, if you find this term, this is going towards hypomania, and as I told, 4 days are required for the diagnosis, correct? This short time period, correct? Okay. And schizophrenia will discuss briefly, but let me tell you the two important terms which you search, in the questions. One is circumstantiality, one is tangentiality. Circumstantiality, tangentiality, both are going towards diagnosis, correct? Okay. And I was talking about conversion disease, right? Now, conversion disease, also known as dissociative disorder. I will give an example. Like, say, I say a school-going child in class 9. I say, suppose in class 9, a school-going child, he has a paper, an exam to go for, say maths, which he doesn't like, and he is not prepared for the exam. So he is at stress. Okay, he is at very stress mode, and before going the exam, he just fainted. He fainted before going to the exam, and after he repaired from that, he completely forgot that he had that exam that day. This is a conversion issue, right? So this we say as conversion disease, right? That his stress has been removed. Now he completely forgot that he has to go for an exam. This is the conversion disease, correct? So here we will see something like la belly indifference. So liable indifference is when the say you say the patient has cancer, right? And if you say that you are having cancer or symptoms of cancer, his facial expression will be indifferent. Like normally, if you say someone that you have cancer, he will be frightened or there will be different facial expression. But you may see in this type of patients, they will be smiling, right? In spite you are giving him a sad news, he will smile at you. This is conversion disease, right? Labelly indifference, correct? He is indifferent towards the thing you are saying or towards the news, correct? And another thing is bizarre gait. Bizarre gait is, there is a gait issue, like he will walk in a peculiar way, correct? Okay. So now I will go to two important topic. One is Wernicke's encephalopathy. This is one. Another is Korsakoff psychosis. Correct? Korsakoff. So one is Wernicke, one is Korsakoff. So Wernicke, you just remember the terms GOA. G for global confusion. O for ophthalmoplegia. A for ataxia. Correct? And you can remember the sites where these there may be petechial hemorrhage at the mammillary bodies, right? You can just keep it in mind, though it is not important. I've not seen it in exams. So just remember these 3 points: the Wernicke's encephalopathy is global confusion, ophthalmoplegia, and ataxia. Correct? Global confusion, ophthalmoplegia, ataxia. Okay. Coming back to Korsakoff psychosis. In Korsakoff psychosis, there will be confabulation. Confabulation, what we say as memory gaps, right? Means if you ask the person what you did yesterday, say he will remember everything up to 12 a.m. and then from 3 p.m. onwards he remembers everything, but between this 12 a.m. to 3 p.m. what he did he forgot, and this one he will fill up with fancy memories. This is said as memory gap. I just give an example, but actually it is a remote thing, not that recent. It's a remote thing. I just give an example. Correct? This is Korsakoff psychosis. Correct? So there is confabulation, memory gap, and another thing is there. There is anterograde amnesia. Anterograde mane recent. So there is recent memory loss. What we say as anterograde amnesia. So one thing is there. Amnesia. Amnesia may be anterograde or maybe retrograde. Retrograde means remote, anterograde means recent. Anterograde seen in Korsakoff psychosis and retrograde seen in ECT. Is very important, guys. So two types of amnesias: anterograde amnesia, retrograde amnesia. Anterograde seen in Korsakoff psychosis, retrograde seen in ECTs. Correct? Don't remember this. Don't don't forget this, right? So anterograde in Korsakoff psychosis, retrograde in ECT. Okay. So now I will discuss about the duration and conditions. This will help you to fix the diagnosis during exams. Like duration, if it is 4 days, then it is going towards hypomania. Okay, 4 days hypomania. If it is 1 week, it goes towards mania. 1 week mania. 2 week, it's depression, OCD. Correct? If it is 4 week, 4 week is for PTSD. Remember there are 4 letters, so 4 weeks. Correct? 3 months is for delusion. 3 months is for delusion, right? 6 months is for generalized anxiety disorder or somatoform disease, right? And 2 years is for dysthymia. Now dysthymia is for a constant long period. For 2 years there is low mood. Correct? And there is another term known as cyclothymia. Cyclothymia, there is low mood, high mood, low mood, high mood, right? This is cyclothymia. Here treatment is valproate. Valproate treatment in cyclothymia, correct? Okay. So there is also an important term known as the NPH. NPH is the normal pressure hydrocephalus, correct? Normal pressure hydrocephalus, right? In this condition, you will find there is dilated ventricles, right? There is dilated ventricles, correct? Okay, let me use okay. So in this condition, you will find there is dilated ventricles. Okay, so there is dilated ventricles, correct? And this is a triad of condition. You just have to remember the three triads. Okay, one you can see dementia, then urinary incontinence, and ataxia or apraxic gait. They also says magnetic gait, all the same. Dementia, urinary incontinence, urinary incontinence, apraxic or magnetic gait. This is the triad of normal pressure hydrocephalus, correct? Okay. Now there is something known as the Beck's triad. These triads are also important, guys. Keep it in mind. Beck's triad, right? This is a triad of three things: hopelessness, worthlessness, and helplessness. Of these, hopelessness is the most important. This has been asked in your exam. So Beck's triad, hopelessness is the most important one, right? This is seen in uh, depression as well as in schizo, correct? Okay. Now there are some important personalities. One of them is Sigmund Freud. Sigmund Freud, uh, he discovered some important diseases at his time. So you have to remember those. Like he is the father of psychoanalysis, cocaine, then road to hypnosis, correct? Then psychosexual development, right? Then dream analysis, as well as structural and topographical theory of mind. So psychoanalysis, cocaine, hypnosis, road to unconsciousness, then structural and topographical theory of mind, dream analysis, right? So these things you must remember related to Sigmund Freud, correct? Then you should remember we related to Jean Piaget. Jean Piaget, uh, cognitive development. So actually in and I said they may give this one match or match the personalities with the diseases they discovered, right? So Jean Piaget with cognitive development, right? And just now I mentioned Aaron Beck gave the backstride. These are easy, don't miss them. Aaron Beck gave the backstride, which I mentioned just few slides ago. And then there is I mentioned the important ones only. Okay, this has been asked in your previous exam, either in Niemann's or other Central Institute exams. Ian Pavlov, he discovered Pavlovian conditioning. Okay, I will not discuss the discoveries. I will just name them, right? So Jan Pavlov, Pavlovian conditioning. Just remember here he paired unconditioned stimuli to generate conditioned response. Unconditioned stimuli for a conditioned response. That's it, right? Then Eugene Bleuler. Okay, he is also important because he termed schizophrenia, right? And there is also four A's of Bleuler, which has been asked so many times, guys. The one is autism, one is ambivalence. Ambivalence means confusion between yes or no. Another is affective flattening. Affective flattening means there is no change in the facial expression. That is flat expression, right? And then there is association loss, the loss of association with the surroundings and everything, right? So autism, ambivalence, affective flattening, association loss. These all are given by Eugene Bleuler, correct? Okay. Now I will talk about few drugs, right? Drugs are also important, antipsychotic drugs. I will talk about some specific drugs which has been so many times asked in your exam, right? Okay. So first I will say that of course the drugs that are given in psychiatric conditions, they are meant for it, but often some unwanted for a 5% 1 to 5% population, some unwanted, circumstances happen because of those drugs. Right? We will see that. First is I will talk about exercise. We all know that exercise are given in can be given in depression and all, right? With the conditions, in many psychiatric conditions we can give exercise. ठीक है ना? Okay, but we must also know that there is a condition known as paradoxical suicide. Now the important thing is that exercises are given for preventing suicide or for preventing depression or for decreasing depression, whatever you say, but sometimes it may lead to suicide, which is known as paradoxical suicide for those little population, right? But for majority of the case, it is a wonder drug, but for few cases, this is the result, paradoxical suicide. This is a side effect of exercise, correct? And also you must remember that for exercise, the treatment for premature ejaculation, right? This I will discuss in my later slides, correct? Then there is benzodiazepines. Where do we use benzodiazepines? In conditions known as delirium tremens, which occurs is important. Is been asked in our this one last NEET PG. It occurs 48 to 72 hours after alcohol withdrawal. This delirium tremens, and for this delirium tremens, we give a drug known as lorazepam, which is a benzodiazepine. Plus, we give IV thiamine. Why IV thiamine? Because there are nutritional deficiencies in alcoholic patients, right? Otherwise they may develop Wernicke's this one or Korsakoff's. So to prevent that, we give lorazepam plus IV thiamine in delirium tremens, which occurs 48 to 72 hours after alcohol withdrawal, and lorazepam is a benzodiazepine. Now you must also remember that this benzodiazepine, which is given to actually reduce agitation, may cause paradoxical agitation. This has been asked so many times. Paradoxical agitation. Now important thing is only for 0.5 to 1% population. Paradoxical agitation is the side effect of benzodiazepines, correct? Now there are 2-3 dictums which I want you to now there are 2-3 dictums which I want you to focus on. Like this is the okay. So this is a drug. I'm talking about clozapine. Clozapine Clozapine is a gold standard antipsychotic. But when will you give clozapine? When two antipsychotics will fail, then we'll go for clozapine, not at the beginning. Why? Because clozapine has various side effects like agranulocytosis, myocarditis, there may be neutropenia. So neutropenia means there will be infections. So every fortnightly you have to do fortnightly blood investigation has to be done at the beginning 6 months of starting clozapine. So we have to be very careful, right? Because every fortnightly in the first 6 months we have to do blood investigation, and the next 6 months every monthly, correct? Because of which this side effect granulocytosis, myocarditis, neutropenia, which may lead to infections, correct? So when two antipsychotics will fail, we'll go to clozapine. Okay. Next, we'll go to bupropion. This is also an important drug which has been asked in your CMS exam. Bupropion. Bupropion is an Bupropion is an antidepressant. Correct. Bupropion is an antidepressant which will increase your dopamine. Correct. So bupropion is an antidepressant that increases your dopamine level. This also can be used for nicotine cessation. This has got the least sexual side effect. Correct. This has been asked. This is the least sexual side effect, and there is no weight gain. So bupropion is antidepressant that increase the dopamine level, can be used for nicotine cessation, there is least sexual side effect and no weight gain, correct? Now I will discuss few other syndromes which is most important, like Capgras and Frijoli. Now Capgras is hypo-identification, right? Cap Capgras is hypo-identification, where the person will identify his own spouse as stranger. He will say his own wife as a stranger, correct? This Capgras is completely hypo-identification. Will not identify the person. And Frijoli is hyper-identification, just opposite, where you will feel that the person, that the stranger, has come in a different appearance as a persecutor, right? Like what I say, mm, what to say is like that. He will feel that the same person has came in a different appearance near him, right? So this Capgras versus Frijoli has been repeated, numerous times. Okay. Now I will discuss about side effects of few drugs. So first I will discuss about SSRIs. So SSRIs side effect is mainly some GI distress, nausea, vomiting, diarrhea, this some GI bleed, okay? GI bleed, and this is some effect towards sexual performance as well. But you must also remember this is used for treatment of premature ejaculation. Why? Because it's one of its side effect is delayed ejaculation. Hence becomes the treatment for premature ejaculation. This you keep in mind, correct? Next, TCS, tricyclic antidepressant. This has also been repeated. So, tricyclic antidepressants, correct? So tricyclic antidepressant side effect is mainly your anticholinergic side effect. Anticholinergic side effect, which is confusion, right? Blurred vision, constipation, erectile dysfunction, like this. So when you find these terms, which is mainly anticholinergic side effect, this is saying this is meant to be TCS side effect, right? Where we give TCS in atypical depression, correct? Now, if we classify antipsychotics broadly in two categories, one we will find as first generation, one is second generation, or the newer antipsychotics, right? Now, first generation drugs are like the old drugs, which we say as haloperidol or flupentixol, glucopentixol. These are the drugs, first generation drugs, haloperidol, So they mainly had, mainly targeted dopamine receptors, right? So their main side effect was hyperprolactinemia, or these that mainly dopaminergic side effects, right? This one different movement disorders, but the new generations, they they target dopamine less, so their side effect is mainly metabolic side effects. By newer I mean clozapine, this one your risperidone, aliperidone. This is the newer antipsychotics, correct? So I will discuss that in my future slides. So one important topic is hyperprolactinemia. Hyperprolactinemia. Now, which antipsychotics causes hyperprolactinemia is most important? First is risperidone, most important, risperidone, and then its derivative only, which is paliperidone, right? And amisulpride. So these three causes hyperprolactinemia: risperidone, paliperidone, amisulpride, correct? Clozapine I already mentioned. Clozapine causes a granulocytosis, myocarditis like side effects already mentioned. Correct. Next is quitapine. So, quitapine causes cataract with the side effect, right? Okay. So next is neuroleptic malignant syndrome, which we say as NMS. Correct. Now the neuroleptic malignant syndrome has got a triad of delirium, led by rigidity, autonomic dysfunction. Delirium, led by rigidity, autonomic dysfunction. This is a triad of neuroptic malignant syndrome, and treatment is dantrolene. Now let me discuss what happens, because this may come as a case scenario. So in this case, actually, uh, there is a family history, the strong family history. Okay. So the patient will say that previous other siblings died in the OT table. So actually when the patient is in the OT table, what happens, there is increase after giving anesthesia, there is hyperkalemia, right? Increase release of potassium in his body, this hyperkalemia. So what happens, there occurs delirium, net type autonomic dysfunction. Okay. So and there is a strong family history of such conditions, in their siblings or who died in the auto table itself because of these conditions, right? So similar type of case scenarios you can find in the question, right? Now side effect of lithium is also important. Side effect of lithium mainly will what will find coarse tremors. This word you will find in your question, coarse tremor, right? Or delirium. These are this is common with other antipsychotics as well. Then there may be seizures, myoclonic jerks, right? So coarse tremors, delirium, seizures, myoclonic jerks all may be found in lithium poison, correct? In the or you can say side effect of lithium. Now why I said lithium toxicity or lithium poisoning is because these features are found only when it is more than 1.5 milli equivalent per liter, whereas therapeutic dose is zero point 0.6 to zero point 0.8. This is the toxic dose. Toxic dose will give rise to coarse tremors. Toxic dose is more than 1.5 milli equivalent per liter, and this will give rise to coarse tremors. And therapeutic dose is zero point 0.6 to zero point 0.8. This is the best. Okay. Yes, and lithium is given in where, in acute mania. Okay. Okay. And now valproate side effect is also important, right? Valproate side effect, we will find things like alopecia is there. Then obviously it is teratogenic, you know that it gives rise to neural tube defect and TDs, correct? And for which we give, for if you take this drug we give folic acid. Anyway, that's a different topic, let's not deviate. Then there will be hyperammonemia. Then there is graying of hairs, fulminant hepatitis can also be found, correct? In lithium again there is a side effect like Epstein's anomaly, but although the fear is more than any type of evidence, right? Now we will see some therapies and where it is used. Okay. Therapies and disease or conditions, right? The first therapy is EMDR, which is used in PTSD. I will explain. Like, first you remember that I have already mentioned PTSD, 4 letters for diagnosis will take 4 weeks. Now what is PTSD? PTSD is a life means, say a woman survived from an earthquake, or someone survived, someone after rape. These are life threatening events. They have survived after a life threatening event, and these events, they repeatedly come at dreams, or there are flashbacks, everything is there. So this makes a diagnosis of PTSD, right? This is completely different from something known as what we say social adaptivity, or these things. Is not that type where we adapt to normal social circumstances. A life threatening event is involved for 4 weeks. A life threatening event is involved for 4 weeks, right? And the patient has flashbacks of those events, which makes the life bit tougher. So I will say this occurs in RTA, or following a rape or any other incidences that happened in his life, or his or her life, that he survived, and he's now having flashbacks of those, right? So treatment is EMDR. By EMDR I mean eye movement, you know repetitive desensitization. Okay. So here what occurs, we the patient, we tell them to move his eye. One means this direction, followed by this direction. So these are mainly, I'm just giving a brief idea about the therapies and all, right? We're not going into the details part of it. So this is eye movement desensitization therapy, right? Okay. Then next one is ERP, which is for OCD. Now here I will take the liberty to describe OCD also. See, OCD is obsessive compulsive disorder. Means something there is obsession, something is compulsion. Obsession, thoughts. Compulsive, acts. So what are the thought obsessions? What are the act compulsions? Right? Like I have a say for example, I have a repeated thought of that my hands are dirty. What we have or had in our COVID times, right? That our hands are dirty, and we hands are dirty, and then followed by it we do hand washing. This is normal. But what if it occurs on a regular basis, or it comes on a daily basis? Means every time you have a thought that your hands are dirty, and every time you go for wash, dirty, wash. So this one, dirty is the thoughts, which is the obsession form. Compulsion is the act, which is the washing, right? So this is your OCD. Actually, it is a thought possession disorder. This also is came in your INI set. This may be repeated in other exams as well. This is a thought possession disorder. Thought possession disorder, correct? And treatment for management is exposure response prevention. Means what? The I'm just explaining this one so that some idea, right? It is like that. I can say that you have a thought that your hands are dirty. Immediately you will go for wash, but I will not let you wash your hands. I will make you wait for 10 minutes, the next day 20 minutes, the next day 30 minutes. How long I can. By that way, I am detaching this obsession from the compulsion. I hope you are clear. This is exposure response prevention. We are preventing the exposure and the from the response. Means the the minute that the thought came in your mind that my hands are dirty, you will go for wash, but I will not let you wash your hands. Okay. Next, I hope it is clear. Then there is something as flooding or systemic desensitization. Okay. My pen is not working, guys, today, so just manage. Okay. So this is treatment given in phobia, flooding and systemic desensitization, correct? Now in phobia there are actually phobia is phobia towards a thing, a phobia towards an object, phobia towards a particular circumstance. There are two things. One is flooding. Flooding means all of a sudden I will expose you to that situation. Say you fear cockroaches, and all of a sudden I will put you in a room where there are full of cockroaches. This is flooding. Okay. And systemic desensitization, what is this? Is like, today I will keep you in a room where there is one cockroach, next day I will keep in a room where there are five cockroach. Like systematically I will improve it, and by that way your phobia will be gone. So this is the brief, right? Okay. Then there is DBT for BPD, dialectical dialectical behavioral therapy for borderline personality disorder. Now this is done by Marsha Linehan. She discovered it, Marsha Linehan. Okay, let me write the name. So DBT is developed by Marshall Linehan for the borderline personality disorder. It's a dialectical behavioral therapy, just a behavioral pattern, right? So BPD mainly has relationship troubles. They may attempt suicide to harm him, herself or himself for gaining sympathy, right? Not with the intention to die, correct? By the way, I must also tell you that the most common method of you know suicide is slashing of wrist, correct? As per now, slashing of wrist most common method of suicide, correct? Okay. Now, what we will discuss now? Yes. Now there's the important topic: mental health uh, association. What we say, MHA 2017, right? Actually, it is mental health review board. Also, is said like that. Okay. So this we will discuss. So in this, ECTs are completely prohibited. ECTs are not given now until unless it is required. Okay, if it is required, we will first inform mental health review board and then you will take their permission that whether I can do ECT or not. Straight ECTs cannot be done. Yes, modified ECTs can be given, but again you have to take permission if the thing is not emergency type. Modified ECTs means I will give an anesthetic agent like methotrexate, right, while doing the ECT, and I will give also a muscle relaxant. So anesthetic agent plus muscle relaxant, and then I can perform the ECT, correct? No sterilization procedures. Okay, no sterilization procedures, correct? No chaining. Chaining should not be done. No chaining, no sterilization. Okay. Then there is decriminalization of suicide. 309 IPC is gone. There is no 309 IPC. Means if someone previously, what used to happen, if someone attempted suicide, he used to keep in he was supposed to be kept in jail. He was to be jailed for the attempt he has done. This is, I think, this is inhuman. Like already he is in a depressive mood and for which he committed suicide, and then again after his failed attempt, you are keeping him in jail. So anyway, this one is gone now. This is trashed, but 306 is there. What is this? Anyone who is trying or anyone who is blackmailing another person to commit suicide, he will be punished under this. So 306 is very well there. 309 is gone. Then there is something known as very important one, advanced directive. Advanced directive. Now here the patient has the right to do three things. First, he can plan or he can choose what treatment he wants, treatment preferred. Also, he can choose what treatment he doesn't want, treatment not preferred, and he can choose a nominated person so that when he loses his capacity, this person can take care of him. Correct? He may be any one of the family member, any one of his close relatives, friends, anyone, but willingly, not by force. Means he cannot just choose, and he cannot choose just anyone. In that matter, that anyone cannot be his nominated person. That person must give his will that okay, I want to be his nominated this one caretaker. Then he can register that person. This will go to mental health review board and they will review it and for the further proceedings. So what treatment he will undergo, what treatment he will not undergo, and the nominated representative all will constitute the mental health association, right? Okay. Another thing is there section 90. This has came in new months, right? Section 9090. Here, for the first instance, you can keep the person for 90 days admission. Second instance, 120 days admission, and third instance 180 days admission. ठीक है चलो. And also within 72 hours of admission for two cases, minorities, by minority I mean the children who are admitted for children admissions or child admissions, or in case of women, within 72 hours you have to inform to mental health review board that I have admitted a minority or a woman for this purpose under examination. So this is all under mental health system, right? Okay, so let me talk about few drug abuses now, often asked in UPSC CMS. So most common substance which is abused, please mark my word, abused, is nicotine. Okay, abused. Substance used is caffeine. Caffeine in coffee and tea, whatever. So this is used, this is abused. Right? Abused nicotine, used caffeine. Okay. Treated substance abuse most commonly treated is alcohol. Okay. Most common substance, illegal substance, which is, if you find the word illegal substance that is abused, is cannabis. Is illegal, right? Okay. If you say most common prescription drug abused, benzodiazepine. Prescribed drug abused. Non-prescribed drug abused is NSAID, like paracetamol, anything that doesn't need any prescription, and they are used, notoriously nowadays. For anything, people use take paracetamol, right? So NSAID are the non-prescription drug abused. Benzodiazepines are the prescription drug abused, like alprazolam or something for sleep-inducing drugs. Like people use them as so they use them, but they're prescribed drugs. Without prescription, pharmacy will not give you, right? Now, some few thought conditions associated with CISO, right? You must also remember, you can find in the question that will help you in diagnosis. So, first is thought withdrawal, thought podcast, thought insertion, and um, yes, these three only. So, first is thought withdrawal. In CISO, the patients will feel that the thoughts are being withdrawn from his mind, right? And it has been aired after withdrawing from his mind. Then again, he may feel that the thought has been broadcasted, means the other person know my thoughts without my knowledge, right? This type of thing. So thought insertion means the other person will insert his thoughts in my mind. These are all the features of CISO. And then previously mentioned circumstantiality, tangentiality means they will deviate out of the topic, or they will deviate and come back to the topic. Okay. Okay. Now there is an important question regarding CISO I'd like to discuss. Like according to DSM, according to ICD, first I will say, okay, less than 6 months, sorry, more than 6 months we diagnose as CISO. But in DSM, there is a criteria. First is less than 1 month, more than 6 months. Again, here more than 6 months is CISO, less than 1 month is acute psychosis. Then what is the period between 1 to 6 months? This has been asked. This is 1 to 6 months is schizophreniform. Schizophreniform, correct? So according to DSM-5, less than 1 month acute psychosis, more than 6 months schizophrenia, 1 to 6 months schizophreniform. ठीक है? And ICD more than 6 months is full-fledged schizo. Now in schizo we find something schizo prognosis I am talking about. Something is good prognosis. This has been asked, and bad prognosis. Now what I will say as good prognosis in schizo means the prognosis is better. Means if he complies with his treatment and everything, the outcome is better. Prognosis means outcome, right? So good prognosis, acute onset. If the onset is acute, this has been asked, acute onset or late onset. Okay. Or there is a precipitating factor, or stress is there, some kind of stress, or some symptoms, compliance, good family support, females, is all good prognosis. What are bad prognosis? Males, negative symptoms, family history of schizo, substance use, insidious onset. bad prognosis. Next, I will talk a condition about enuresis. So, if it is a child, we will go for psychoeducation. No, actually, there are different modalities of psychoeducation, bladder training, bell pad. You know, uh, there are calendar methods, right? And there are lastly, treatment is desmopressin. But if it is a child, we will go for bladder training methods or bell pad methods. Directly don't jump to treatment. Treatment is for elder patients, correct? So yes, you can prefer psychoeducation to the parents and bladder training bell pad for the child. Treatment, if all this fails, then we'll go to treatment, correct? Okay, so next one hot topic is lithium. Regarding lithium tests, like when will you do the blood test after, if you want to test the blood lithium levels? See, first of all, the half-life of lithium is 24 hours. So only after 5 days after lithium therapy we'll do the test, correct? And in the fasting, okay, after the trough levels, that is after 24 hours, correct? So I will say, if you give the lithium at 8 p.m, you can check for blood level next day 8 a.m after fifth day of starting the lithium dose, okay? And this will complete, right? So after 12 to 24 hours after the fifth day of the dose at the trough level, okay? And as I mentioned, zero point 0.5 to 1.5 is the effective levels, although 0.5 is milliequivalent per liter. So this is the effective levels, although the treatment part is 0.6 to 0.8. But anyhow, more than 1.5 lithium level is toxic. Here we will see toxicity like cold tremors and everything. Let's see if I missed something or not. Yes, so I mentioned about your TCA toxicity. And TCA toxicity, there is uh, toxicity, mainly anticholinergic side effects as I mentioned, but there is treatment as well for this anticholinergic side effect, which is come in your recent exam. It is sodium bicarbonate, right? Sodium bicarbonate. Okay, so few syndromes I've missed. I think I should cover that. One is Othello syndrome. So Othello syndrome mainly occurs in alcoholics. This first occurs in alcoholics mainly. Uh, this is mainly jealousy towards his own spouse, right? This we say as delusion, jealousy, or delusion infidelity. He will feel that his spouse is having relation with another man, like that. Okay, okay. Now there is Magnan syndrome, or we say as formication or delusional parasitosis, where this is actually cocaine psychosis related to cocaine use, right? The person will feel that insects are crawling in his body. Okay, so that's what is said as delusional parasitosis. Okay, by the way, you have to also know about delusion versus delirium. See, delusion is thought content disorder. Mark the word content. And delirium is altered consciousness. This is not well oriented, right? And altered consciousness, and this is a emergency situation, right? Delirium. Okay. Also, you must remember about this one, alpha synucleinopathies, right? First is Lewy body dementia, then Parkinson's disease, right? So these are alpha synucleinopathies. Okay, Lewy dementia, there will be visual hallucination plus antipsychotic sensitivity. Okay, also do remember Alzheimer's disease, where there will be visuospatial deficit. This is a tauopathy. Okay, tauopathy. And apo e4 will increase the risk, e2 will decrease the risk. Okay, and mainly the thing occurs in temporoparietal areas, right? Then there is somatoform disorder. Somatoform, see, this somatic means bodily symptoms, right? Bodily symptoms, or you'll have complaints of, that in this part of body I have pain, or this part of the body I have these problems, right? In contrast, there is one thing known as hypochondriasis. This is a hypochondriasis is a illness anxiety disorder. The patient complain of illness, this illness, that illness, will come with diagnosis. The doctor, I am having gastric cancer, or I am having brain tumor. Like this will come directly with the diagnosis. This is a hypochondriasis. 6 months required for diagnosis. Right. Next, that's Munchausen. Munchausen is, factitious disorder. Means these are called doctor shoppers. Means they will go to different doctors for this, for different doctors' opinion, gaining sympathies. Correct. Okay. Now I will go to some graphs. Like if this type of graph you see, this is a negative deflection, this is your K complex, and again there is this type of frame, this is sleep spindle, and on both these are found in NREM 2. Okay, K complex, sleep spindles, K complex the negative deflection. If you find this wave, the sleep spindles is all clubbed together. These two are found in NREM type 2. Okay, next, now this is another type of wave, like this pattern. Okay, I will again draw for you. This is seesaw waves, like seesaw, that that is used to uh, cut the wooden ply and all. So this seesaw wave, this is found in REM sleep. REM is also known as paradoxical sleep. Okay, okay. So there are a few personality tests. I will tell the name. There is London test. This is for frontal lobe assessment. Frontal lobe assessment, correct. Then there is Wisconsin card sorting test. This is also used for frontal lobe assessment, correct. I don't think there will be image based. There is much image based question in psychiatry, but I think one may come if it at all comes. Then there is a possibility of one thing coming. So I will try to show that. Okay, so this is Rorschach's ink blot test. I will write it first. Rorschach's ink blot. So okay, this is a personality assessment test. Okay, so just see these images. This may be asked in your INI if it at all is asked, and I don't think other images are necessary for your other upcoming exams. Okay, so I think I've covered some important topics here, and if something is left out, I will cover it in next session. So you can also put it down in your comment box, right? Thank you all. So I am closing it, right?